the beauty and the cleanliness of this hospital. When I fell ill, I panicked because I honestly did not know where to go. I had never been to a hospital in Ghana for an emergency, and I feel like you hear nothing but horror stories when it comes to hospitals in Ghana and just general negativity about the healthcare system in Ghana, which I'm not saying are not true, but are just things that made me panic when it was actually time to use the healthcare system in an emergency. But staying at this hospital honestly really put my mind at ease. And I know exactly where I'll be going if, God forbid, I solid 9 out of 10, and I really do hope to see hospitals of this quality across all regions in Ghana someday.
Hi guys, welcome back to the channel. This lady visited a government hospital in Ghana. Ugmc Government Hospital is located in the Greater Accra region, and she also shared her experience she had with the doctors and the nurses in the hospital.
Started my day off in the emergency room of Ugmc Hospital, after which I was then moved to another ward when my condition stabilized. I was told I would have to unfortunately spend the night in the hospital, so I opted for my own private room just to make my stay more comfortable. I didn't really know what to expect just because I've never spent the night in a hospital in Ghana, but I was honestly pleasantly surprised by what I was offered. The room was really clean and spacious. I had my own appliances like a microwave and a kettle. I even had my own fridge and a flat screen TV. I also had my own private bathroom, which was also a really good size and really neat. I was given a variation of different soaps, bath gels, shower gels, toothbrush, toothpaste, you name it. Basically everything that you would normally get in a hotel. So I made myself comfortable, changed into my scrubs, and then the nurse brought in my menu so I could choose what I was going to eat for breakfast, lunch, and dinner the next day. So the next morning, my cousin brought me some stuff from home, like a change of clothes, my laptop, etc. And this was her reaction when she saw my room. She was genuinely just shocked at how nice the room was and likened it to a hotel room or just somewhere you would stay on holiday. So I got myself out of bed, drew my curtains, that was my window view from my room, and then I hopped in the shower, which was cold, but I didn't mind because I normally do take cold showers anyway. I got out of the shower feeling super refreshed. I hadn't showered in a whole day, so best believe I was in there for ages. When I came out, my cousin had hung my boo-boo dress in the wardrobe. So this is the wardrobe that you do get in your room, which is also a really good size. You even get some hangers. So I went in and changed and even sprayed some perfume because, as I said, I hadn't showered in a whole day, so I was doing everything to get myself feeling back to normal. I was honestly just so happy to be back reunited with my laptop so I could do some work. So I tried to get into the Wi-Fi and realized I needed a password, so I just rang the buzzer for the nurse to come. She came in, gave me the passcode, and I was in. The Wi-Fi worked a lot faster than I expected, so I was able to get a good amount of work done while my cousin made herself comfortable in her little corner and dozed off. I started feeling a bit hungry, so I decided to dig into my breakfast, and I got what was supposed to be an English breakfast, a chicken salad, and some fruit. The nurse then came in to check my vitals, like my blood pressure and my temperature, and then she also drew some blood to run some tests. This was like my 4th blood test, and I only have 2 arms, so you can imagine just how sore my arm was by this point. I was over it. So I decided to just unwind for a bit by just taking a stroll around the grounds, and this is where I really got to take in the beauty and the cleanliness of this hospital. When I fell ill, I panicked because I honestly did not know where to go. I had never been to a hospital in Ghana for an emergency, and I feel like you hear nothing but horror stories when it comes to hospitals in Ghana and just general negativity about the healthcare system in Ghana, which I'm not saying are not true, but are just things that made me panic when it was actually time to use the healthcare system in an emergency. But staying at this hospital honestly really put my mind at ease. And I know exactly where I'll be going if, God forbid, I do have another emergency. So yeah, we spent about 15 minutes just exploring the grounds of the hospital. I feel like these videos don't even do the hospital justice of capturing the sheer size of it. Correct me if I'm wrong, but I feel like this may be one of the biggest hospitals in Ghana. As a cousin came to pay me a visit, so we chilled out for the rest of the evening. I ate, we watched Love Island. The results for all my tests had come back, and I was finally given the go-ahead to be discharged. And I was low-key kind of sad to be saying goodbye to my room, and that just goes to show how much I genuinely enjoyed staying in this hospital. I'd rate my experience at this hospital a solid 9 out of 10, and I really do hope to see hospitals of this quality across all regions in Ghana someday.
That was a pleasant experience this lady shared about the government hospital in Ghana. The place is very neat. The experience she had there, the nurses were nice to her. Let's take a look at the video of what you can expect when you visit this hospital in Ghana.
The main purpose for setting up Ugmc was to give cutting-edge clinical services, and then also to train medical personnel and then carry out research that all has to do with operations of the service.
The University of Ghana Medical Center was conceived as an academic medical center. In other words, it was set up to train health professionals to the very highest level, but it was also expected to do cutting-edge research to help discover new medical innovations, new treatments, to test new vaccines and new medicines. But in order to provide an opportunity for training and also to do research, it needed to offer patient services to ensure that you can attract the number and the type of patients you need in order to do research but also to do training. So that has led to the center having these three objectives of training, research, but also providing clinical services.
UGMC is unique in the sense that UGMC essentially has three components. So it provides medical services. It also has a training and a simulation center, which plays a critical role in the training of various kinds of healthcare professionals. And then it has a research center. And so to the extent that we have these three components in one medical facility is unique to UGMC in this country.
UGMC is unique in the sense that we strive to put the patient or the clients at the center of everything that we do. We take the needs of our patients, our clients into consideration. Whatever service that we provide, the client is at the center. They are our focus, and we make sure that they are comfortable and they get the best needed medical care.
Clinical Services Wing of the UGMC is a world-class service. It is a service that puts the patient and the family at the center, and we're hoping that each patient that comes here is actually a VIP and is going to have a wow experience.
Our nurses, they behave professionally. When it comes to communication, they have good communication skills, and they put joy in the patient who is on admission.
Our department comprises of three different units: the thoracic, the cardiac, and the vascular unit. And the vision is to offer a premier cardiac service to our patient. The hospital is equipped with the latest in everything. We have the latest heart lung machine, even within the West Africa sub-region. What is unique about the department is the teamwork. We have the cardiac anesthetists, we have the specialist cardiac nurses, we have the cardiologists, and we have the surgeons. We all come together to decide on a patient. It's unique that you meet 3 or 4 people to take care of one patient. We try to offer cost-effective treatment. We don't want to be too expensive to offer you the best. For heart surgery, we want to even beat down the price so that we can offer the service to as many Ghanaians as possible.
Here in UGMC, our policy is that once you come here and you are diagnosed, we will make sure we'll find your medication for you, and anything concerning your treatment, we will teach you, make sure you know how to use them.
We have a medical simulation center that can be used to train medical personnel in terms of clinical skills acquisition. We have environment that can mimic clinical environment, and we also have the nursery mannequins that also can mimic clinical conditions.
The medical training and simulation center is the best, not only in Ghana, but in the West African sub-region, and it is one of the biggest in Africa. We use the high fidelity mannequins and a few low fidelity mannequins to mimic what happens in the hospital. We train health professional students, medical students, dental students, allied health students, nursing, pharmacy students, practicing health professionals, the lay public who we train on basic life support.
The Medical and Scientific Research Center, basically, we want to create an atmosphere where innovative and translational research is made easy. And on this vision, we stand to promote clinical and support innovative ideas in medical research.
the UGMC, it is not just about re-echoing the axiom that the customer is king or the patient is king. Management is committed towards ensuring that everybody working in the organization, including outsourced staff, understand the implications of good and bad client services and how it affects the bottom line. So at UGMC, when we say we are client-centric, we mean it.
My experience at UGMC was excellent. Compare the kind of treatment that the nurses gave me before inviting doctors, but I was very, very happy about that.
We have over 28 senior specialists and consultants. We also have specialists and medical officers. We have specialists in the areas of OBGYN, that's obs and gynae. We have plastic surgery. We have ENT specialist consultants, to be precise. We have ophthalmology. We have urology. We have cardiothoracic, cardiology, and all these high-level specialties.
I'm excited and elated for two reasons. The first is that the idea of having a medical village has been a vision for the University of Ghana for 58 years now. And having UGMC fully operational now for me.
The very first day I went to this government hospital, I was so shocked. I cannot believe that this was actually a hospital. I have never seen any kind before. It was so different. Honestly, the camera does not do justice to this hospital in Ghana. When you see this hospital, the very day I saw it, I keep driving around. I tell the driver to please, let's drive around. I was just so marveled. I was so surprised that we have something like this in Ghana, and I never believed, because I used to see this hospital online. People have talked about this hospital, UJMG hospital, a lot of government hospital. People talk about the amazing government hospital in Ghana, so I put it upon myself to go and see this particular hospital for myself, and trust me, it was a luxury. Like, it blew my mind off. The land was so big, the place was so conducive, the environment was so clean. Like, if you are here and you go to this hospital, government hospital in Ghana, trust me, you just get well immediately, because the environment is so clean. You are going to breathe fresh air. Like, there's no smell, there's no dirt anywhere, because I literally went inside to these hospitals to see things for myself. That day, I literally spent the whole day in the hospital. After I left the hospital, I went to the school, I went to the campus. Like, I literally explored that vicinity that day. It was amazing. So it was a fresh breath. Indeed, that hospital is the first class. I've never seen any kind of hospital like that before. When I went there, I was really surprised that we can have a government hospital in that standard in Ghana. A lot of amazing government hospitals we have in Ghana. A lot of them we have in Ghana. Ghana is really developing so well. Like, when I see these things in Ghana, I ask myself, wow, these people are really doing a lot. They are doing a lot for the country. And this lady also shared how much she spent when she went to the
how much I paid when I was admitted at UGMC. I paid a deposit of 1,000 cedis when I first arrived at the emergency room, and then I paid another 781 cedis once my treatments were done. So that came to a total of 1,781 cedis for the emergency room. In the ward that I was transferred to, where I was admitted, I paid a total of 2,305 cedis, and that included a 1,750 Ghana cedi charge for the VIP room that I stayed in, which included breakfast, lunch, and dinner. For the level of attention and care that I received from the staff members, from the nurses to the doctors, I personally think it was worth it. I was seen to more or less immediately when I got to the emergency room. The nurses and doctors were very friendly. They took their time with me. I didn't feel like I was being rushed away. And on the day that I left to go home, I had to request to be discharged, because they actually did want to keep me in for one more night, just to make sure I was 100% okay to go home. That just goes to show how meticulous they are with their jobs. So I definitely think the price I paid was worth it.
The most important thing is that she got what she wants. There's some money, when you spend it to something that deserves it, you don't have to feel whether it's expensive or it's not expensive. To me, it was not expensive at all. And she also said the money worth the treatment she got from the hospital, because why not? That hospital deserves, it was a lot. So if you can get a standard hospital like this, Trust me, everybody will be happy, and I wish and I pray my second home can one day deliver a standard government hospital like this in Nigeria. I will be so glad that one day I can visit a government hospital in this level of standard. Like, you can see the interior design, you can see the infrastructure, the machine, everything is put together in this hospital, because I have been there, I have seen it for myself. So I wish and I pray that my country one day will also have something like this that I will be so proud of, because I was so proud when I visited that vicinity when the hospital is being built. So please, if you have not liked the video, do me well by hitting the like button, okay? And don't forget to hit the subscribe button, turn your notification bell, so whenever I drop a new video, you will be the first to be notified. Drop your comment below of what you think of the video. Tell me more about your experience. Have you visited the hospital before? What was your experience when you went there? Share with a friend who would love to watch this video with you, and I will see you in my next video. Bye for now and stay blessed.